Fever and febrile convulsions. One of the most common complaints and accompanying symptoms of illness in children is fever. Oftentimes, a mother will complain of the child's fever and ask you to prescribe an antibiotic. But does every fever require an antibiotic? And how can you tell? Is this a bacteria infection requiring antibiotics? Or is the fever caused by a virus, not requiring antibiotics? These are a few things you can assess. In order to assess and to help you differentiate between a bacterial infection and a viral infection, you can check the following things. Number 1, suckling power. If the child is still breastfeeding, you should ask the mother about the suckling power, not the duration of feeding. Check suckling power by putting your small finger at the roof of the mouth of the child. This is an indicator of his activity. If the child is older, you can ask him about appetite. Is the child eating well? Bacterial infections are accompanied by a decrease in appetite. So, to check for bacterial infection, ask about appetite. It also should be known that, even though it's not a rule, but bacterial infections usually occur during the summer more often, and viral infections occur during the winter more often. But it's not necessarily a rule. The next thing you can check is the activity of the child. Check and see if the child is able to play normally or not. If there is a high-grade fever and poor suckling power and low activity, this probably means that the child has a bacterial infection. So, unless the child is able to play during the day between fevers, he probably has a bacterial infection. Another way, which isn't totally reliable, is to check the secretions of the child. In viruses, it is white or clear, and in bacterial infections, the secretions are yellow or greenish. So ask about suckling power, child activity, and secretions in order to determine whether the child needs antibiotics or not. Note, any fever in a child less than 3 months old should be considered as septicemia and should be given antibiotics. Also, any fever lasting more than 48 hours should be treated with antibiotics, as this is usually a bacterial infection. All of these will help you determine if antibiotics are needed or not. So how should we go about treating this fever? Medications such as analgesic anti-pyretics are present in several forms. There are oral forms, injections, and suppositories. We also have the option of using cold packs or cold foments. If the temperature of the child is 30 degrees Celsius or above, you cannot use oral medication. You must use a suppository or injection or use cold packs with them until the temperature falls below 39 degrees Celsius. So, once again, oral antipyretic analgesics do not work in temperatures of 39 degrees Celsius and above. So, if you're going to use cold foments, they should be done in a certain way. We are usually taught, or we see on TV and in movies, that the cold pack is placed on the forehead. Contrary to belief, this is however incorrect. The whole purpose of using the cold pack is to decrease the temperature of the body. So we want to find a place on the body where there is a lot of blood flowing through it. There is not that much blood flowing at the forehead. So we want to decrease the temperature of the blood so where there is a lot of blood vessels. We can place the cold pack on the neck, under the armpits or in the axilla, and between the thighs. These are the best sites. If the mother prefers not to use cold packs, you can suggest the mother to give the child a bath. If she's reluctant because she's afraid the child might catch a cold, tell her to bathe the lower body of the child until the temperature goes down. This is the whole idea of using cold packs, to decrease the temperature of the blood flowing through the body. Note, however, do not use ice to bring the temperature down. Use regular water temperature. Analgesics and antipyretics. Remember, oral analgesic antipyretic drugs cannot be used in temperatures above 39 degrees Celsius. Oral medication is taken 3 times a day, while injections and suppositories are taken only twice a day. Determining the dose of oral drugs in pediatrics is quite simple. There is a very safe way to dose oral drugs as following. For syrups, you use a third of the weight 3 times a day. So for example, if the child weighs 12 kilos, a third of that is 4, so you give 4 centimeters orally 3 times a day. If a child is 1 year old, it will weigh 10 kilograms, so a third of 10 is roughly 3.5 centimeters. So you can give them 3.5 centimeters per mouth 3 times a day or every 8 hours. Most medicines follow this dose. The first analgesic antipyretic we have is paracetamol. Paracetamol is safe from the first day of life and in pregnancy. It is also safe for those with bronchial asthma and is safe for those with allergies to medications in general. The only downside of paracetamol is that it is more of an analgesic than it is an antipyretic. So, patients are often advised to use cold packs as well as paracetamol to help bring down the body temperature. There are paracetamol drops as well, where the dose is 1 to 2 drops per kilogram 3 times a day or every 8 hours. If you want to be safe, just use 1 drop per kilogram 3 times a day. So, a baby that weighs 8 kilograms will take 8 drops per mouth 3 times a day. A newborn weighing 4 kilograms will take 4 drops per mouth every 8 hours. Syrups are easy. We agreed that most syrup doses are a third of the weight 3 times a day, and injections and suppositories are taken twice a day, every 12 hours, morning and evening. Note, however, that in some countries we reserve giving paracetamol suppositories until after the first year. I know I've mentioned that it's safe during the first year, but we avoid the suppositories during the first year because the dose of the paracetamol in it is too high. The next drug we have, or groups of drugs we have for as an analgesic antipyretic, is ibuprofen. Ibuprofen is better than paracetamol, but it's not as safe. Therefore, we give it only after 6 months. But as an antipyretic, it is stronger than paracetamol. So, remember, ibuprofen can be given after 6 months of age. There is brufen syrup, the dose would be a third of the weight 3 times a day. And there are marcofen suppositories, 100 milligrams, given twice a day. The next analgesic antipyretic we have is diclofenac. Diclofenac is contraindicated in bronchial asthma and should not be used before 1 year of age. We have 2 types of diclofenac. We have diclofenac sodium and diclofenac potassium. Diclofenac sodium is mainly antipyretic and has a delayed onset but prolonged action. Examples would be a Voltaren suspension or a diclofenac ampoule. Diclofenac potassium is mainly an analgesic, has a rapid onset but short duration of action. An example is Cataflam that comes in tablets, ampoules, drops, and suspension. Note, acetylsalicylic acid or aspirin is not used in pediatrics because of the potential to cause Ray's syndrome, affecting the CNS and the liver of the child, and may be fatal. Also, just for general knowledge, that you should know that in pediatrics cases where the fever is more than 41 degrees Celsius, we can administer a drug called aspegic to be administered in the hospital. So, before 6 months of age, you can give paracetamol. It's completely safe. After 6 months of age, you can also use ibuprofen. And after a year, you can add diclofenac. Remember, syrups are given a third of the weight 3 times a day. Drops are 1 drop per kilogram 3 times a day. And injections and suppositories are twice a day. Be familiar with this page and try to memorize it, as it will be used in many illnesses that we will cover in the future. Febrile convulsions. Knowing how to manage a fever is very important, as one may encounter a condition known as febrile convulsions. It may seem scary at first, but with calm nerves and focus, it is easy to take care of. The mother will usually approach you freaking out because her child is convulsing and his eyes are in the back of his skull. Don't panic. If there's a fever accompanying these convulsions, this is called febrile convulsions. If you lower the child's temperature, you will get rid of these convulsions. Place the child on his side and take measures to lower their temperature. If they are wearing heavy clothes, take them off, and you can use cold packs, suppositories, or injections to lower the body temperature. Most importantly, don't panic. These should usually last for about 5 minutes. You have up to 15 minutes before you should begin worrying and take the child to the hospital. But these convulsions usually last for less than 5 minutes and go away when the child's temperature is reduced. Then the child can continue at home on anti-pyretics, and if necessary, an antibiotic may be added to his regimen. So, even though the mother's freaking out, the most important thing is not to panic and take measures to reduce the child's temperature.